Hello, this is Unit 14.1. Complete a table with words from C or positive. Put a straight mark in front of the straight syllable in each word. The first one has been done for you. Now an adjective. Exhausted, exhausted. Fatigued, fatigued. Lethargy, lethargy. Tiredness, tired. Point true. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sort. Present with, put on, and word out. Point 3. Complete the sentence with the correct form of the verb present. 1. A 7-year-old man present with a 9-month history of increasing shortness of braids. True. The most common presentation, loss of consciousness. 3. Cranial artery may present as fever without any obvious cause. 4. The patient usually presents with a severe sore throat. 5. The presenting symptom in this patient could fair be due to renal failure. 6. Other conditions with a similar presentation include osteoarthritis. 7. Reducing role in an important presenting complaint of colic disease. 8. 2 months following presentation, the patient was able to work well. Point 4. Read the patient description of the symptom, then complete the case report. Look at C opposite to help you. I was wearing a few months ago. In the beginning, I used fear of color and a bit tired, but lately I have been feeling completely worn out at the end of the day. I'm not eating any more than usually, but have put on 9 kilos in the last years. My motions are hard and my hair had started to fall out. Case 13. And 50-year-old housewife who had been working for months previously. 1. Complaining of tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her GP. Although she denied eating more than usual, she was constipated and she noticed that her hair had started to fall out. Find word in the box with opposite meaning. Look at B and C opposite to help you. Adequate, inadequate. Again, for. Insidious, stood. Likely, unlikely. Sever, mere. Rare, common. Point 2. Main word combination using a word from each box. Look at B and C opposite to help you. Bone marrow differential diagnosis in severe wounds, iron deficiency, pernicious anemia progressively increases liberation sense. Point 3. Complete the sentence. Look at A, B, and C opposite to help you. 1. A 39 years old man presents with a history of progressive abdominal distension over a period of 6 months. 2. Breathlessness may be caused by vitamin A deficiency. 3. The breathing and purple are caused by abnormal platelet function. 4. The white cell count is normal, so we can exclude acute leukemia. 5. The yellow color of the hair, skin, and conjunctiva is probably due to jaundice. 6. There was a palpable mass in the ring upper quadrant of the abdomen. 7. Treatment is aiming at restoring fluid balance with adequate intravenous fluids. 8. The anemia may be due to increased red cell breakdown. Point 4. Complete the conversation. Look at C opposite to help you. Professor, what is again the diagnosis of pernicious anemia on physical examination? Student. The program started quite astutely, so it didn't have the typical insidious ones. He doesn't have any skin pallor, and he doesn't have symmetrical paresthesia or accent vibration sense, and I couldn't feel he'd explain. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. 16.1. Label the diagram using words from the box. Look at A opposite to help you. 1. Skull. 2. Jawbone. 3. Spine. 4. Breastbone. 5. Rib. 6. Collarbone. 7. Shoulder bladder. 8. Thin bone. 9. Kneecap. 10. Shin bone. 16.2. Match the type of fracture 1 at 5 with the description A at E. Look at B opposite to help you. Open. There is a break in the skin. Community. The bone is broken into several pieces. Display. The broken pieces are separated. Green stick. The bone is bent. It occurs mainly in children. Impaired. The broken pieces are pushed together. Point 16.3. Complete the test box extra. Look at C opposite to help you. Reducing a fracture involves trying to return the bones to as near to the original position as possible. If a fracture is allowed to occur in a display position, the fracture will unite, but it may go on to malunion. Unit 17.1. Complete the table with words from A and C opposite. Then complete the sentence with words from the table. Verb, noun, and adjective. Verb: delay, delay, delayer. Develop, development, developing. Distance, distinction, distanced. Fail, failed, failing. Nourish, nourishment, nourished. 1. Baby with the fertile alcohol syndrome may present with failing to treat. 2. Abdomen distension may be due to an liver. 3. A small amount of alcohol in pregnancy can affect fetal development. 4. Mortality from meals can be reduced by better nutrition. 5. Delay in one or more of the meals may be the first sign of disease. Point 2. Complete the sentence. Look at A and C opposite to help you. 1. After sitting, baby learned to crawl and then to walk. 2. A child who has started eating solid food has been weaned. 3. Someone who is not very tall is said to be of short stature. 4. The studies Achilles development are known as the melons. 5. A child who is beginning to develop sexually has achieved puberty. Point 3. Write a common English name for each disease using your medical knowledge. 1. Lat pathology ground. Moon. 2. Difficulty opening the mouth. Jab. 3. Rash and lack posterior occipital none. Herman Metz. 4. Paroxysmal cold with vomit. Whooping cold. 5. Powdery and vascular fair on true. Chickenpox. 6. Cow and cold following my rash. MERS. 7. Sore throat and rat, scarlet fever. 8. Slow joint and hard murmur. Remote fever. 9. Fever following my mouth weakness. Polio. 10. Cold with stroke. Crop. 18.1. Complete the table with words from A, B, and C opposite and relate 4. Put a street mark in front of the street syllable in each word. The first one has been done for you. Verb and noun. Inhibit, inhibition. Produce, production. Relents, relents. Replace, replacement. Secret, secretion. Stimule, stimulation. Point 2. Complete the page from a textbook using the illustration and your own knowledge. Look at B opposite to help you. Pulse or GNRH gonadotropin relation hormone are released from the hypothalamus and stimulate trigger. RH and FSH release secretion from the pituitary. RH stimulate trigger testosterone producing secretion from lead cell of the testes. Testosterone feeds back on the hypothalamus, inhibit GnRH secretion production. FSH stimulate trigger testosterone. Cell in the similar tubular produce mature sperm and the evening A and B evening cause feedback on the pituitary to the correct FSH secretion production. Point 3. Complete the sentence. Look at A and C opposite to help you. 1. A food chain affects many parts of an organ of gland. 2. A localized chain affects only one part. 3. His diet is deficient in iron. He doesn't get enough iron. 4. Except T3 and T4 increase the basal metabolic rate. Point 4. Match Merz David Sinon 1 at 7 with the question her doctor asked A and G. Look at the opposite to help you. 1. Tenorea. Are you growing normal? 2. Eating more. What is your appetite like? 3. Heat intolerance. Do you prefer hot weather or cold? 4. Overnight speed. Are you able to sit and relax? 5. Palpitation. Have you ever felt your heart beating rapidly or irregularly? 6. Waiting lots. If your weight is steady. 7. Tremor. Do your hands snake? Unit 19.1. Complete the table with words from B opposite and relation 4. Verb. Noun and adjective. Verb. Accommodate. Noun. Accommodation. Verb. Country. Contrition. Contrited. Cover. Converted. Delayed. Delation. Delayed. Drop. dropping, oscillation, regression, point through. Match the picture 1 at C with the condition A as F. Look at B opposite to help you. Dropping of link is picture 6. The light purple is picture 3. Irregular purple is picture 3. Carrot is picture 5. Skin is picture 1. And country's purple is picture 4. Point 3. Complete the extra from and textbook. Look at the opposite to help you. Hypnoscopy. Examine the retina with an ophthalmoscope is possible with the pupil. Delay to obtain the measurement view. Look for pupillament and inflamed shape. MRI and cataract study. Assess the state of the artery and note the presence of any narrowing as well as keeping at artery various cross. Unit 20. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a teen girl with sleep fever. She was not obviously dehydrated. The temperature was 38 Celsius. Pulse 100 minutes. Blood pressure 110 minutes. 80 mmHg. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was no distinct. There was generalized tenderness which was most marked in the right lower quadrant and was associated with most quiet but no rigidity. There was no repugnant tenderness and no masses, whether fair, bowel sounds were reduced. Point through. Match the description of the store 1 at C with the condition most likely to cause the A at F. Using your medical knowledge at B opposite to help you. Type of store condition. 1. Loose bloody. Is usually colitis. 2. Lucy bar burki. Is colic disease. 3. Cry coloring. Is auditory jaundice. 4. Blood terry. Is guttery yours. A small heart. 5. Is irritable bowel syndrome. 6. Clear watery with muscle. Is shoulder. Point 3. Match the first 1 at 7 to the doctor's question. A at G. Look at B opposite to help you. 1. Blood. Have you passed black store? 2. Bowel habits. How often do you open your bowel? 3. Change in bowel habit. Are you going to the store more often than normal? 4. Bulk. Is the size of the amount of the store normal? 5. Color. What about the appearance of the store? 6. Consistency. Are the motion hard of looks? 7. Offensive. Do the motion have an unusual smell? Unit 21.1. Write a simple English phrase for each of the medical terms below using your knowledge. Look at A and B opposite to help. 1. Hysterectomy. Surgical removal of the womb. 2. Menorrhea. Heaving period. 3. Sanctity. Inflammation of one of the tubes that connect the ovary to womb. 4. Cervical biopsy. Biopsy of a small piece of the tissue removed from the neck of the womb. Point 2. Read the conversation between the gynecologist and patient and see opposite incomplete the note about the patient. Minor is 12 JRC. Menstrual cycle is 4 at 5 28. RMP is 150 through ago. Menorrhagia, no. Dysmenorrhea, no. Discharge, a little white discharge. Point 3. Now write the question what the doctor asked you. Look at the opposite to help you. Menarche. How old were you when you start to get then your period? Menstrual cycle. Are your period regular? How long do the period last usually? RMP. When was your last period? Menorrhea. Would you say they are late or heaving? Do you get close? Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between the period? What color is this? Point 4. Complete the case report on what is needed. 3. Look at B and C opposite to help you. Case 15. And 35 years old woman has been having prolonged period lasting for 8 days. When the patient closed for 9 months, there was no bleeding between periods, or after in color, her periods were not particularly painful. She has no notice any hot fluids of night stream, and her genital hair had always been good. She has taken the other contraceptive period a year previous when has a boy was fixed. She had had a normal pregnancy when she was 25. Unit 22.1. Complete the conversation based on the case history and be opposite. Doctor, what seems to be the problem? Patient. I have been getting palpitation. Doctor, how long have you had them? Patient, for about 6 months, but I have had her problem for years, with tightness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I have to sleep on 3 papers. I had a mutual barber who replaced me 3 years ago, and that improvised him for a week. Point 2. May word combination. Using a word from each box. 2 words can be used B and C opposite to help you. At rest, atrial fibrillation, cardiac output, cardiac failure, heart failure, on effort, pitting edema, and premium beat. Point 3. Read the word a patient would use to describe the symptom below. Look at A and B opposite to help you. 1. Dyspnea. Breast lens. 2. Arrhythmia. Palpitation. 3. Ornoria. Breast lens. 4. Arrhythmia. Sleeping. Point 4. Complete the case report. Look at A, B, and C opposite to help you. Case 13. A 60-year-old woman attended her GP at surgery complaining of breathlessness on exertion. This had been increasing over the previous 8 months. Unity is world producing program at around 5,000 meters. Working on the labor, there was no history of chest pain. She had several episodes of fat palpitation, which lasted 20 to 30 minutes and were associated with some shortness of breath. She has noticed some swelling of the athlete by the end of the day. This disappeared overnight. Point 1. Complete the table with words from A opposite. Put a extract more in front of the extract syllable in each. First one has been done for you. Verb and noun. Verb. Auscultate, auscultation. Examine, examination. Inspire, impression. Palpate, palpation. Percu, percussion. Point 2. Put the step for examining the heart and circulation in order according to 4-step system. Look at A opposite to help you. A. Measure the heart signs. Percussion. B. Are there any murmur? Auscultation. C. Feel the radial pulse. Palpation. D. Look for clubbing. Impatient. E. Local the asper beat. Palpation. Not any 3 palpation. Point 3. A doctor is presenting the case of a 43-year-old woman admitted in the cardiology department. Complete the test of her presentation. Looked at B O positive to herpes. On examination, she was present with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180, 100, and was irregular in time and thoughts. Her blood pressure was 130, 90, and her GP was of centimeter, showing normal volume. With respiration, her peripheral pulse were present, and there was no central or peripheral synapses. Her upper beat was displaced to the anterior axillary line but still in the fifth intercostal space. Her heart sunk with very intensity when she was initially examined. It was known that she had pain symptoms immediately. More. Her best as the aspect when she was examined some hours later. There was a harsh pericardial friction put all over the pericardium, or the diagnosis at that time was of mitral stenosis and incompetent with a recent of pericarditis and atrial fibrillation.